Okay. We call to order. Roll call. Ms. Hathaway?
Dr. Moore,
Yes.
Dr. Robinette.
Here.
Dr. DeGuzman, Ms. DeWitt,
Yes.
Mr. Adamson.
Here.
Mr. Griffith,
Yes.
Ms. Johnson. Here.
Okay, I'm going to announce that their quorum is established, and so we'll go ahead and get started. We have a new board member, Miss Jessie Jack Johnson. And could you tell us a little bit about yourself?
Thank you.
Okay.
Thank you very much. My given name is Jessica, but I go by Jessie for the
Okay.
most part. Hello, everyone. I teach at Wittenberg. So I was appointed to this board position through a connection at Wittenberg. We have lots of connections with the health department. I teach in the nursing department. I'm a registered nurse for the state of Ohio, and I work in the hospital in London right now as a part-time gig. And then teaching is my full-time job. I have a husband and children and a grandchild also by step family. So that's kind of exciting. Yeah, I like sports and I like people and
Well, welcome. Okay. All right. Moving on to additions.
Dr. Moore,
Yes,
can I ask Lori to introduce one of her staff that's here?
certainly.
Mind?
Yes, we're gonna put introduction at the beginning because this is, if you could stand, please. This is Elle Millender, and we're really happy that she is part of our Help Me Grow home visiting team. And she has been with us for 6 months, and she has parenting duties to take care of. So I said we would introduce her at the beginning. And this is Ellington, her daughter. So we're very happy to have Elle part of our team. You can say something if you wish.
Thank you all for the opportunity to work with the Help Me Grow team. Everyone has been fantastic, and it has been a wonderful experience working within the district with Help Me Grow. And I appreciate you so much for introducing us early because I have to do bedtime and bath. So thank you.
You guys can go ahead and go if you want,
Yeah.
or you can
Thank
stay and
you.
listen for a while.
Thank you.
Okay.
Thank you.
Good night, everyone.
Bye. Thanks, Elle.
You're welcome. Okay. All right, any additions and adoptions to the agenda? Okay, if there is no additions, I ask for a motion, a second to adopt the agenda.
So moved.
Second.
Okay, all in favor, say aye.
Aye.
All opposed, same sign. Okay, we announce that the motion is carried. All right, so we're down to item number 4 on your agenda. Approval of last meeting minutes from October the 16th. If you had time to look at those, do you have any additions or modifications to the minutes? No. Can I have a motion and a second to adopt the minutes?
So moved. Second.
Any discussion? We have a vote, all in favor, say aye.
Aye.
Aye. All opposed? Okay, motion carries. All right, we have public comments. And so we're gonna have some public comments.
part of an agenda item.
Okay, it's part of the agenda item, so we'll wait till we get to that item. And then we'll be moving on to old business. In old business, we have sewage variance at 12-12811 East National Road. Ms. DeWitt.
So as requested at the last meeting, a summary of the different types of septic systems was provided in your packet. Also included in the packet is an email response from the Ohio Department of Health stating that this variance defeats the spirit and intent of the rule and should not be granted. Are there any questions regarding any of the systems outlined in your packet?
Were those systems outlined given to the family?
No,
Okay.
they were not.
Okay. All right.
They're just definition of all the possible systems.
All the
They may
possible.
not be applicable to this property. They were
Okay.
just, you wanted a little more background on the
Yeah.
types of
Yeah.
sewage systems installed and all that.
Okay,
We thought the action item was also to find out the cost. Because they wanted to know if one of the other options was a cheaper option. And that was something that you were going to provide.
I don't have costs, so that comes from installers.
Hmm.
We don't have that.
I thought that was the gentleman's question from last month.
That's the way I understood it
Yeah,
as well.
that's how we both understood that. We provide that.
We can't get, I mean, we cannot ask an installer to quote a cost for
And
us.
we didn't know where she was getting the numbers from. We didn't know. We thought maybe, I know that sometimes when you fill out permits, like you have to give an estimate or something, so I don't know. I just know the board member had said that he wanted to see if there was a cheaper option, because that was one of our reasons for asking for the variance.
Yeah, we don't have costs. We don't, that's not something that we do. If we misunderstood that from the board, we should have clarified that last month.
okay, so, as we stand right now, we have a list of different types of discharging systems or systems that can be used, and we can give them the list, and then they can look at who could be the best cost for that.
So
Okay.
we've looked into all those systems.
Okay,
The only ones that were not, priced out are the ones, let's see here. Were the additional ones that were added, through that email that we hadn't been aware of, which was the Anua system.
mhm,
And, so the mound was already evaluated, the spray was evaluated, drip was evaluated. The only one that was not was the Anua system. And we can't get a full price on that, until there's a design. But according to the installer that we've worked with thus far, there's been two. The first one, did not want to move forward with us because he has 35 years experience, was not familiar with these systems, these newer systems, and he didn't feel comfortable learning it. And the second installer has told us that the spray system is indeed the cheapest option, as Mr. Miller had stated in the email that he sent to Zibby, discussed in last meeting.
okay.
So we're assuming that's the case.
Okay, so, you have a cost for a spray system then?
Correct.
Okay. And according to the Ohio Department of Health, if there can be a system that can be placed on your property, then we cannot approve a variance.
That's not the way I understand that rule. I mean, the whole purpose of a variance is to vary the regulation, so that's why we're coming for a variance.
Right, if there's no other option for it to go anyplace else, then we could grant you a variance. But because you have a place on your property where it can go, then we cannot, it increases our liability as the health department to grant a variance.
But that's part of our variance, is that it's not feasible for our farm, our lifestyle that we're using the land for, because of the land that we'll lose due to that spray system. The goats and chickens will not be allowed to graze on that area if there's a spray system on our land.
So just to clarify, I guess, what you're now saying is in this meeting, you're saying that you cannot evaluate a variance because of the code in place. Is that what you're saying?
Yes,
So the application for variance is not something that applies to us?
no.
They will still, so it was tabled, they will still take a vote on your variance.
Mhm,
They will still do that tonight.
mhm,
That's what you have something before you that you do have to take
Take a
action on,
mhm.
either approve or disapprove. If you look at the law, it says that the spirit and the intent, even with a variance, it cannot violate the spirit intent of the sewage rules. And the Ohio Department of Health did, we asked them, we told them exactly what was going on. Zippy did that by email. Welcome to those emails. If you want to make
Yeah.
records requests, that's no problem. It specifically says if a system can be put on site, again, we're talking about an on-site system versus something that discharges off-site, that we can't grant a variance. And the way it is right now, there is an option for an on-site system, so the board cannot violate the spirit and intent of the rules, even asking for a variance. The variance itself would violate the spirit and intent. It's different for if you were saying, I wanted to install my sewage system within 6 feet of a property line or 4 feet of the property line, and the requirement is 10. That is not disrupting the spirit and intent of the laws. It is less room than what is recommended and best practice and science proves, but that doesn't actually violate the spirit and intent of the law. Those are lawyer terms that they like to use, but that is what the law explains.
So in that Ohio Administrative Code, it says that spray systems shall not be sited in areas of active production of food for human consumption. So how is it that you can require us to put a spray system on a property that is in active production of food for human consumption?
So we're not
That's our
requiring,
question.
we're not requiring the spray system. What it says, what is before the board tonight is there an alternative to a discharging system? The answer is yes. That's the question before the board.
The question.
We're not going to dictate which one that you are able to install or select with the installer.
That question was already answered, correct? Because they already said that our property met the requirements for having spray and didn't meet requirements for other systems. So that question was already met. Is that correct?
I don't know. I didn't work with your designer. I don't know if there's an alternative. Even, I mean, we have to separate out. Unfortunately, I know you hate to hear this, but cost is not necessarily a driver of whether or not a system can be installed. So even if another alternative system could be installed that does cost more, that answers that question. There is another alternative system that could be installed. I don't know the answer to that.
So in the email from Steve that we discussed at the last meeting, he mentioned a mound,
Drip.
drip,
Anua.
Anua,
Spray.
but that they would cost more than the spray. The spray would be your most cost-effective system according to your designer who designed it. So he's not saying that spray is the only thing you can fit on it. He's just saying that's your most cost-effective option out of everything. Because to put in, say, a mound system, you have to clear out the wood, all the trees, the whole area of the mound. Whereas for a spray system, you only have to clear out trees and large vegetation 10 feet from that spray head.
Understood.
So, and then with the cost of the system itself, which designers know, you know, how much does it cost to install a mound versus a drip system versus a, you know, based on the tank you need, the materials that you need to be able to put that in. So does that help answer the question?
Yes, but no. I feel like last month, I mean, this seems like new information. It seems like last month we should have been told that this variance request was not an option. So I'm kind of confused. Was there some sort of legal consultation that was done between last month and this month?
So after last month, we reached out to the State Department of Health asking different questions about spray irrigation systems
Right,
because they're a special use approval.
right.
And after the meeting is when they came back with the email that said there is the availability of an on-lot septic system. And by approving a variance to discharge and go off-lot,
Highlights the spirit.
yes.
Spirit and intent. And if you'll recall, if the board will recall, and you'll recall, I said that last month. I said an off-lot discharging system is only to be used when there are no other options or on site. I said that last month. So it's not new information. We just got confirmation that my thinking and reading of the law, it was correct. We consulted with the Ohio Department of Health, who they are the technical experts in when it comes to this. They provide that technical expertise to local health departments. We reach out to our Department of Health a lot of times daily or weekly at least for lots of different things.
So can you tell me then what a variance is for? Because if the variance cannot apply to our situation, what situations do variances apply for? Because a variance by law is an exception from code or regulation.
And you've applied for it, and they're going to decide on that variance, whether or not to approve it or not. Since you've already brought it, yes.
Okay.
So what about the form? In the form, it states there's a line in there that you can't go to the next step unless, I thought it said something about other options and the homeowner agrees to that option. I don't remember
No,
that
that's
exact word.
not in this.
That's not this one? Oh, I'm sorry.
You asked what another possible, like an example of a variance. I gave you the one about encroaching less than 10 feet to a property line. Those are the common ones. If someone's installing a new system, repairing a system, get too close to a property line, too close to a building. I'm trying to think of some of the other more common ones. I mean, those are probably
Those
the
are
ones
most
that,
common.
that's probably 80% of what we do is encroaching too close to something, property line of their well, something like
No
that.
other place to place one.
Yeah.
Okay. Yeah, I guess that defeats the point of having the written letter of permission from the neighbor also.
Yes.
Okay.
Which was our action item.
Sorry. I thought I turned that off. I so apologize.
I might comment that what we thought before the clarification was that with written permission from the neighbor, legal permission to run
Onto their
treated
land.
water off property, that would be an acceptable variance. But the clarification is, if there is a solution on property, then there is, the variance itself would violate the spirit and intent of the law. And we would be overruled. And there is an option available to you. It just
It's not
interferes
feasible
with your
to a farm.
ability to raise goats there.
Correct.
If you put a fence around the spray area, then you would protect your livestock, your animals.
And you would lose an area of foraging.
Yes.
That's what we're. So is there any information on what percentage of the treated water would discharge off our property? Because it's our understanding that water stays on our property and as it overflows, it would discharge off. So I hear the words that it would be, you're discharging it off your property. How much of that occurs? Like, is that a regular daily occurrence that this would discharge off our property? Because we are under the understanding that it would primarily stay on our property, except for in times of like rain or other things where there's other water in that area that would join that waterway and then it would carry off. Is that information available?
So what happens with discharging systems is all the water that you use throughout the day goes into your aeration, your septic tank. And so if you use 300 gallons in a day, then 300 gallons is going to be discharged and go wherever the discharge point is. So if your discharge point is to that drainage swale on the neighbor's farm, 300 gallons is going to go to that each day, that however much you use in a given day.
Is that how they would discharge it? Because it's our understanding it would go into a discharge system on our property first, on site, like a dry well type of system or something like that, that would be on site.
No, so the way they work is it's a tank that treats within that tank. Similar to a septic tank, you'll have a compartment where all the solids settle down and then your water continues to move on and it gets treated through aeration. And then it is pumped past a UV light. And then that pipe is just discharged out to the surface of the ground.
On our property.
Well, it depends on how it's designed, but typically it goes towards, it's not going into like another, like a dry well or a leach line or anything like that. It looks like what was being proposed is the pipes just going straight out towards where that drainage ditch is and out to that drainage swale.
You saw that somewhere? You
What-
said what was being proposed.
So that's what, when we were talking to you guys last time, that it would go towards that, drainage swale on the other farm. When you have 300 gallons or 100 gallons or however much you use in a day, typical household is 120 gallons per bedroom is what they use as an estimate of how much water people use a day. All of that would go out. So if you have a 3-bedroom house, 360 gallons is being discharged all at one time. It doesn't discharge as you use it. It takes and treats it. So it would, you know,
We
But-
were
but
under the
again-
assumption that the discharge system was on our property on site, and whatever was overflow, because there would be a system put in place after the tank. So you had a tank, then you had an aeration tank, then you had like essentially like a dry well type of thing. And then whatever was extra would flow off into the swell of the farmer's lot.
no.
So I think that's
Yeah.
different for us. That's news today to us.
But whether it's pointed towards that swell or not, that's still being discharged on our property. It's just the swell, the path of the water leads in from our land into the farmer's land, which is the swell.
Yes,
So
so,
it's still being discharged onto our land. It's only flowing.
but that 300 gallons or however much it would be each day it just discharges out to the surface of the land. It doesn't go underground or anything. It just discharges to the surface of the ground to a ditch. If there were a sanitary sewer or a storm sewer, it can go into the storm sewer. There's not a storm sewer in your guys' area. But it would go out directed towards that ditch and it's just gonna flow down the surface of the ground. Some of it, yes, would absorb as it's moving across the ground, but not all 300 gallons or, 100 gallons, whatever you use that given day.
All right. Any other questions or discussion? Okay, we have, before the board, asking for a motion and a second approving a sewage variance at 12811 East National Road, South Vienna, Ohio.
Approving. So if you want to approve, you would say yes. If you
Oh.
don't want to approve, you say no.
Okay. Ms. Hackathorn?
You don't have
A motion in a second.
Oh,
Need a motion and a second.
yeah, so talk to me. Okay,
A second.
okay. It's been moved in second. Ms. Hackathorn?
Mr. Adamson,
No.
Ms. DeWitt,
No.
Dr. Moore,
No.
Mr. Griffith,
No.
Ms. Johnson,
No.
Dr. DeGuzman, Dr. Robinette.
No.
Sorry.
So the motion has failed. Okay.
As you have more conversations with designers, installers, Sibby or I are happy to talk to you.
We have had them for months. This is the end of the road for us.
Sorry.
Sewage variance, Ms. DeWitt at 170 Davis Avenue.
Thank you. So this is also a sewage variance that if approved would allow a component of a septic system to be installed closer than 10 feet to a property line, the house, and a utility line. The Ohio Administrative Code lists a minimum horizontal isolation distance between components of a septic system and a structure, property line, or utility service line to be at least 10 feet. The property owner is requesting the approval of the household sewage treatment system rules variance, allowing a portion of the septic system to be installed closer than 10 feet to the property line, structure, and utility line, with the property owner signing a hold harmless agreement. So in this one, you can see in your packet, This is a failing septic system. There is no room for on-lot. And they are wanting to put in a discharging, or needing to put in a discharging system that would discharge up to, we'll use the term ditch loosely because there's not a great ditch along this road. So they're gonna put in a leaching trench that it would discharge into to try and absorb it before it gets out to the ditch and causes water puddling or running into the road.
How close is it to the property?
So we have between the house and the property line, there is about 13 to 15 feet. And on the, if you're looking at it from bird's eye view down, the left side of the house where they're proposing, you also have a gas service line that comes in. So I don't know the exact measurement of how far the gas line is. But from the property line to the house is 13 to 15 feet.
Have they looked at other systems?
So I've talked to the designer a couple of times. We've tried discussing putting in like a line to a leach trench to accept some in the backyard. But you can see fill material where there used to be a pool. That's also where their current septic system is. And a shed in the backyard. So there wouldn't be a lot of room to be able to try and get a leach line in back there unless we put it in the area of the old pool, but not knowing how that pool was abandoned, we don't know how well it will absorb. And on the right-hand side, you can kind of see on the overhead, a black outlined line. That's a concrete pad that they've put over there. Now this shows it looking like it almost goes to the property line, but what do we measure, like 8 feet, 6 feet
Yeah.
between the edge of the concrete and the property line on the right-hand side of the house.
Zibby and I have talked about this one a lot. I will tell you, I don't feel like either of us believe that all the options have been exhausted here. I've got concerns about how close it is to that gas line. If they're going on that left side of the house, the right side of the house might be a better option. They'd have to bore underneath the concrete. I do think that's an option. However, I don't believe we've exhausted all the options for design where it's in the backyard where that old pool was.
Can they put a mound on top of there?
That's possible. I mean, there's, I don't think we've exhausted all the ways that we can talk through some possibilities here. I will tell you, my recommendation is to table this. I don't think you have enough, I don't think we can give you enough information today to make a decision. I mean, that's my recommendation, to table it with asking the homeowner to explore some additional options.
You think us to know where the existing leach field is too?
It's a dry well, I do know that.
Okay,
It is supposedly, according to the drawing that we have, straight out from the tank right
I
in
see.
here.
Gotcha.
And in case you're wondering, installing another dry well is not an option. Dry wells are now considered deep well injection wells. They're not legal in Ohio
Oh, really?
anymore. You will not see a dry well put in Ohio anymore.
That better happen to ours.
You're not the only one.
So can we make a recommendation to table this until we get more information?
So moved.
Second.
Okay, Ms. Hackathorn, we have a vote.
Ms. Johnson,
Yes, I agree.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay. Zibby,
Just keep rolling with
all right, sewage variance at 430 Fairfield Pike.
All right, so we have another sewage variance that if approved would allow a concrete slab and garage to be built on top of a portion of their septic system. Again, as we just discussed, the Ohio Administrative Code lists a minimum horizontal isolation distance between components of a septic system and a structure to be at least 10 feet. The property owner is requesting approval of a household sewage treatment system rules variance allowing a concrete slab and a garage to be built on top of a portion of their septic system. with the property, signing a hold harmless agreement. So, again, if you look at the drawing. So in this one, the current leach field takes up the entire backyard. And they want to install a garage, a concrete slab, and then a garage on top of it on 30 feet of the end of one of their leach lines. And it looks like right up against another line of their leach system. So essentially it would take out 120, potentially 120 feet of their septic system, 60 feet, somewhere in there, of their septic system. There is no other option for a septic system on this property. So when this system fails, there won't be a replacement area. There will be nowhere where we can put another septic system. So it'll have to go to a discharging system. This is the original septic system, which was installed in 1977. So it's already old. And so by putting a building on top of their leach system, we're just shortening the life of the system even more than
Do they understand
we have explained that to them.
So this system is approaching 50 years old, which if you look at all the science and data, it's beyond its useful life. And I think it's subtracting away, part of the system and combined with the fact that there's no other option. I mean, we even looked at, could they put another line to the left? And
That's what I
there's
was
just no room to do that. I think we're setting them up for failure, literally, by taking away part of an already system that shouldn't be doing as well as it is. If it's, I don't even know how to characterize how well it's doing, frankly.
I was gonna say, is it operating like it should?
As far as we know. There's no sewage surfacing currently. We'll put it that way.
Can they put in a smaller garage?
Not in that area. If they would, if it would have to, for them to get a garage, they would essentially have to move it up here. I think their leach lines probably come, I can see this, somewhere around where these trees are.
So how are they accessing the garage? Because if it's,
New driveway.
Yeah,
So-
I'm not sure,
I
like,
don't know if I'm
We don't
seeing
have
it
that.
right.
We don't
I don't
have that
have
picture.
that on my,
you're not, this one?
Oh, here it is. Keep going.
It should be at the
Okay.
very end of the
Oh.
packet.
Sorry.
This one, sorry, keep scrolling.
Thank you.
There's lots of pictures.
Okay, so they're coming in this way.
The only thing I can say is they probably come along this,
because then
I don't know what the
they'd
garage is
be
gonna be used
driving
for.
over even
Yeah.
more of their leach field because it doesn't show the driveway covering.
Okay. So they have to go over drive over
They'd be
to
driving
go
over this part,
into. Yeah,
so they'd have to. I struggle with this because if it fails, it's on them to replace it,
but they don't have an option except for.
but I don't want them to come back at us and say, it failed because because this garage could end up costing them, I don't know what a discharge unit is, but tens of thousands of dollars.
Well, the concern is they're gonna be losing part of their leach pad. And then because of the positioning of the garage, they're gonna have to drive over the leach bed
Right,
in order to
Yeah.
get into.
yeah, so they'd be losing it big.
How deep is the leach bed?
They're not that deep.
I was gonna say, and how deep do you have to dig for a foundation for a garage?
So from
Footers?
what he said is there's no footer required. In his variance request, it says it's concrete slab, no footer required on last partial section of leach line. Prefab metal garage anchored to the slab.
Any additional questions, anybody?
That line on the second, not the 50-foot, but the 70-foot, right where that concrete line, okay, no footer required, but you kind of need some kind of a footer under there. And during construction, they're going to get right on that 70 feet.
Yeah.
And essentially, when you add that 70 to the 50, that's over 25% of the whole system that is potentially going to be damaged or, well, is going to be taken away.
And that's the end of it? That's the
Yes.
very end where it would drain off?
And so if, Zibby, you're saying like whatever amount of water, the wastewater that system used, that it was designed to handle the daily amount of water. And if we're gonna take away potentially 25% of it on a system that's already 50 years old, so it's not operating at 100% now. It's not as efficient as it was the day it was built. It's gonna fail. Chris, that's what you were saying.
Yeah, I think we've stacked the deck. When I look at this, using experience and what best practices are, I think we are going to expedite something that's going to already need to be replaced.
It's gonna fail faster.
Yep.
And in this situation, if they were to put needing a discharge unit, can it discharge over the failed leach field, or where would it discharge to?
I'm not sure. I don't think there's a ditch on that side of the road, but I think the other side of, it's on Fairfield Pike. I believe there's a ditch on the other side. But when we have application for discharging systems, we work with the county engineer's office to figure out the best way where it's going to cause the least amount of issues.
That's true. Yeah, but
Okay. Any additional discussion? Okay, Ms. Hagethorn. Oh,
I don't think there's a motion.
okay. I'm so appreciative of you being here to keep me straight. Thank you. I have a motion and a second, please.
Move to approve the variance? Is that what I can
Yes,
say?
yes, okay. So you made a motion? We need a
To
second?
approve the variance or
The
to,
motion is to approve, and then you can either vote it up or down.
Okay.
Okay, I'll second.
Okay,
You vote on
all right, thanks. Ms. Hagethorn?
Dr. Moore,
No.
Mr.
it.
Adamson,
No.
Dr. Robinette,
No.
Ms. DeWitt,
No.
Mr. Griffith,
no,
Ms. Johnson.
No.
Zibby? Mr. Webb?
All right.
Solid waste nuisance at 2010 River Pike.
Thank you. All right, so this one, we've been working with the property owner since March in an attempt to get solid waste accumulation cleaned up. And while we see some of it disappear, more stuff comes in. So it's just, Chris has got some pictures that we've taken during all our visits there. So you can see it's like there's maybe a fire ring full of trash bags. Looks like different wood. There are a lot of tires, maybe some disabled vehicles, campers. We do not have jurisdiction over like the campers and cars, but we do all the trash.
Are tires considered trash?
Yes.
Okay. So we're asking for a motion and a second to declare a public nuisance at 2010 River Pike, Springfield, Ohio.
So moved. Second.
Any other questions? And we'll have a vote, please, Mr. Floyd.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt.
Yes.
Mrs. Vivi DeWitt,
All right.
environmental health technician, job description.
Yes, so, we had an employee, that was a clerk, and they moved down to part-time and then did part-time in our vital statistics, and they have accepted the full-time vital statistics position, which left an opening with us. But with a lot of sewage field work that we have, we've decided to bring back, we had many years ago an environmental health technician position. And so we would like to bring that back. So they'll part-time in the office doing clerical work and part-time out in the field doing observation work. They will not be able to do all of the work that our environmental health specialists do out in the field because there are certain programs and tasks that you have to have that environmental health licensure through the state of Ohio, but they can do things like our aerator observations. They can do rabies observations for us. They can go out and do pool chemistry, follow-ups on all of our nuisance cases. So we're just asking for you to approve our environmental health technician job description.
Okay. We have a motion and a second approving the environmental health technician position.
So moved.
Second.
And we have this is not going to impact our budget because we used to have a person there before and, okay.
Is it just one?
Just one.
For one?
Okay. Any questions? Ms. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. Johnson.
Yes.
Early childhood assistant job description. Ms. Lambert?
Yes, thank you. There are a couple of reasons that I'm asking for an early childhood program assistant. The evidence-based programs that we do in early childhood require a lot of data entry and tracking. And this is true for PIPS for Kids and especially for Healthy Families America, the model that we use in Help Me Grow. And secondly, now that the Help Me Grow dollars that we generate from billing, we need to develop a mechanism to track the amounts of each home visitor, how much they bring in each month, so we can kind of measure where we need to go with that. So this position would ensure that we can stay timely on our grant requirements and contribute to quality assurance and quality improvement. So that's why I'm asking you to consider this position. And it would come from a little bit from the Kids for Kids grant and a little bit from Help Me Grow billing.
Thank you.
Yes.
Have a motion, requesting a motion and a second for approving the early childhood assistant position. And that's a part-time position?
Yes.
So moved.
Second.
Any discussion?
Just a question.
Yes.
On the position description, regular hours, 15 to 20 hours per week or 40 hours per week?
Yeah, I think you wrote in 30 hours a week in case it ever went up.
Well, it says
Um,
part-time or full-time, so
Yeah.
it's probably
Oh.
covering both options.
Perhaps I left it because I thought,
I think, so we're creating a position, but I'm telling you, we're only hiring a part-time person right
exactly,
now.
yeah.
Okay.
But in the future, I mean, any position could be full-time as
Sure.
well. Yeah.
Unless I misunderstood.
No, that's fine. No, we got there.
Good question.
Mhm. Yeah.
And this is new? This is
Well,
this is
it
new?
is kind of new.
Mhm.
I had a person in the position, my admin person was Mary Kopp that passed away a couple of years ago.
Yes.
So I've been kind of using people on board. I use them for this and then we get far behind and then I use somebody else for a little while and then I use a college intern.
Mhm.
So we really would like to
Yeah,
kind
have
of
a
keep things
focus.
going. Yeah.
Gotcha. Okay.
I have another question. I promise this will be my last one. So when we have an employee that goes from part-time to full-time, do we have to vote on that, or is that something that can be done without our approval?
It can be done without your.
Okay,
approval.
good. 'Cause I like the way this is written because it gives you the flexibility
Yeah.
to, so, well done, whoever had a hand in this.
Lori.
Yeah.
Well done, Laura.
Okay. So we need we had the motion, a vote. Ms. Shannon?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Community Health Foundation grant submission, Mr. Cook.
We are going to submit 3 grant applications to Community Health Foundation for their Health Opportunity Grant Award Cycle, which was previously called Diversity, Equity, and Inclusion Grant. So the first one is going to be for $20,000 to help fund our Health Equity Coordinator position we've had for a number of years here. I don't want to put the cart before the horse, but they like funding this piece of it, so we're going to continue to ask, and hopefully we'll continue to fund that. The second one is $5,000 for transportation. So if we look at the things that are barriers to care for our patients, transportation is right in there. So Cheyenne and I have talked about this, and we feel if we're able to utilize the micro transit system called Field Trips from the city of Springfield to provide some transportation, we'll have a better or less no-show rate. When we briefly had our transportation person here, it was getting people who didn't have transportation. We saw our no-show rates really impacted. And so we want to bring this back, not in a person because we can't afford a person to do that transportation, but we can buy some field trips with the city of Springfield. So that's that $5,000 ask. And then finally, Sandy has written one here. It's a mini grant that is also to the Community Health Foundation for $1,000 for maintenance and calibration of our hearing and vision equipment that we loan out to the schools. So unless there's any questions, just look for your blessing to submit those.
Okay, could I get a motion and a second authorizing the health commissioner to do all things necessary, including submitting the grant application?
So moved.
Second.
Any discussion or questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Dr. Moore.
Yes. Okay, creation of new funds, Mr. Cook.
We're going to create a couple of new funds for next year for 2026. Those are going to be what we're going to call a lead fund and a medical reserve corps fund. Both of those dollars are being taken in and expended out of the general fund right now. The health fund, we'd like to be able to account for them in a separate fund. And to do that, we do need your blessing to create 2 additional funds. I told Jeff, I think our goal is never less than 50 funds, right? No, so these will be used in 2026.
Okay, we have a motion before you to approving we need a motion in a second. Approving the creation of lead fund and medical reserve corp fund.
So moved.
Second.
Any questions or discussion?
What's the medical reserve corp fund going to be for?
So the medical reserve, we've had these grant funds for, oh my goodness, probably might even be approaching 20 years at this point. It's the volunteer group in our community. There's about 100 people on our medical reserve corps. It doesn't fund them because they're volunteers. It funds doing things. It funds trainings for them. Snacks at these trainings. These are federal dollars that are specifically used for the medical reserve corps. It's all across the United States.
So do we not already have a fund for it?
No, it's accounted for in the general fund. And we want to account for it separately just so we can track it better.
Okay.
Any additional questions? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. BEC printer and copier proposal, Mr. Cook.
BEC is a business equipment company. We engaged with them about a year ago as we started looking at all of our copiers and printers because that's part of their business line is copiers, printers, office supplies, furniture, things like that. And they offered to, when I started talking to them about purchasing toner from them, they said, we can do an analysis for you and see if we can figure out how to save you some money. I had heard some really good experiences that I believe the hospitals had with them, Rocking Horse, a lot of other companies have engaged with them and saved some money on their printing and copying. So I said, hey, sure, take a look. So they've done an analysis, and it took, the process took the better part of a year. Now it sounds like a long time, but it was more us getting information to them, and that was the lag. But they've been really good to I said, I know you're going to sell something to us. That's part of your business. I get that. It's not lost on me. But bottom line is I need you to save me money. I will tell you, these toners and drum units, and they just are killing us cost-wise. And so they did this analysis. They said, okay, you've got a lot of costly units in place, a lot of ones that are on desks. Sometimes you have, a printer within 20 feet of another printer, which doesn't make a lot of sense, and it's much more cost effective to print to copiers. Depending on which printer we're talking about, the copier can be 6 to 10 times less per page to print. Probably nothing new to any of you. You've probably heard that, at least in your business interactions. So they gave us a proposal to eliminate our most costly units, replace pretty much everything that we're going to keep in kind of grouped areas for staff. And then also to lease 2 new copiers that are absolutely on their last leg. If you scroll, I know there's a lot of information in here, but if you actually scroll to the very last page, it's page 55, I think, where it says monthly savings difference. It'll actually save us $114 a month. That's not a huge saving, but we are going to get all new machines, and that happens every 4 years. So this is a good move for us. There's going to be a little bit of weeping and gnashing of teeth as I take away some people's desktop printers, but they are very expensive to operate, and we need to get a little bit more efficient. So we're able to get a lot of new equipment and actually save money at the same time.
Okay, I'm asking for a motion and a second authorizing the Health Commissioner to enter into an agreement with the EC.
So moved.
Second.
Any other questions from the group? Okay, Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Personnel policy update, Mr. Cook.
All right, deep breath. This was a lot. And the people that are sitting in this room with you did the work, right? So the core team, the directors you see to your right, and Shannon and Gracie and myself, and Jeff had, I don't know, how many meetings? Too many to count. A lot of meetings to go cover to cover, going through our personnel policy. It was time, and we were due for a cover to cover. I just want to say just a couple quick words of appreciation to the core team taking the time outside of our meetings, but also inside of the meetings in my office, and especially to Shannon, because any clarification on language change that you see that was not categorized as a substantial change, that was Shannon. Because she went through this and she really made it easier to understand things that didn't frankly make sense. A lot of times when it doesn't make sense, it's difficult to apply, right, to your staff. And so we tried to take a plain language approach to it as well. What you have in here is a summary, courtesy of Gracie. She created the summary of all the changes to the personnel policy. We try to categorize these as types of updates. So ones that you see either no change or clarifying, or just, again, courtesy of Shannon, trying to make the language easier to understand. The ones that say substantive changes, you can see what that difference was. I will tell you, Gracie made a good point to me the other day about why we did this. We did this because during some of our staff listening sessions, one of the things we heard was we want accountability, we want clarity, we want consistency of our policies. And so we realized that some of those policies, we were not hitting the mark, or else why would they be saying that in our staff listening sessions? So we tried to do all of those things. We tried to also marry up our policy with the things that were actually going on. They were in practice. Some things weren't always what we were doing in policy. And so we had to reset ourselves and say, okay, this has been the precedent for a while. Does it need to be in policy or not? Yes, we didn't want past precedent in things that reside in my brain or somebody else's brain to be how we consistently apply policies to our entire staff. So a lot of pages of updates here for you to review. Hopefully you had a chance to take a look at that. I will tell you another thank you to the board's personnel committee, who we sent this to, not only the summary, but the entire red line updated policy, which was a lot. And you all reviewed it. We incorporated some of your feedback into it. Some things that we missed. I think, Valerie, I was looking at you, like a couple of things and we're like, oh yeah, thanks for bringing that up. And we made a couple of changes here. It's always great to get another perspective. I don't know if the core team has, you're just happy this is done. I mean, it was a big lift. It was very necessary, and it's not something that's glitzy and glamorous and glittery, right? I mean, this sometimes you just got to sit down and do the administrative piece of this. So I will tell you that as these changes go into effect the first of the year, we're going to schedule in-person meetings with staff to talk through these, because this is bigger than just making one little language change in one section. This was cover to cover. So we're going to schedule, I think, how many, five opportunities for staff to sign up to come sit in this room, sit at High Street in the conference room for an hour and ask about, changes and talk through and clarify things that may not make complete sense on first glance. But hopefully, like I said, using more clarifying language, those questions will be fairly minimal. So we're definitely going to do that, sit in front of staff, not just say, hey, here's the new policy, good luck. So I would pause and take comments from the personnel committee who reviewed this, or questions from the board about what you see in the summary.
Well, I applaud y'all for doing it because it was a lot. And I think it was, a lot of the changes that were recommended were definitely needed. And it did make it a lot more clear for the employees. And I thought it was a nice yeoman's task, because I was like, I'm glad I wasn't part of that and stuff. But yeah, what did everybody else think?
I appreciated the appendix. So, when you have to always refer back to an appendix and you put that in the policy, I thought that was really smart to do. So appreciate that.
No more appendices.
I'd just add to that, the two times that it seems that the employee handbook comes up is when new people are coming on board, where clarity is most important. And then when there's an infraction of some kind and tensions might be high. And that's when clarity is real important. So thank you for this thankless job of going through line by line and making this clear for both, leaders and people who have to follow the rules, people that have to enforce the rules. So thank you. You don't see this a lot. The comment about appendices, you got this ancient document, maybe in some people's eyes, that you just add on another rule and another rule and another rule, and you clean it up. Thank you very much.
So having said all that, is it going to be on a evaluation schedule? Okay. And stuff, because I don't recall seeing that piece.
Yeah, we're doing that with all of our policies. So we're taking the time. We've been trying to work on that this year, categorizing all the policies in different areas, and then numbering the policies, and then coming up with a schedule for everything going forward. We haven't had that.
It's maybe every odd year or every 3 year.
5 years for this.
For complete, yeah.
Covered.
Covered.
Okay, any other questions, discussion?
The next one.
Okay, so could we have a motion and second to approve the changes in the personnel policy as presented?
So moved.
Second.
Any questions? Ms. Hackathorn, roll call.
Dr. Moore,
Yes.
Ms. Johnson,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Audit report.
4 pieces in here for you. The first piece is the combined statement of cash receipts and disbursements. All of those 50 accounts that Mr. Cook has created for us, believe it or not, all collapsed down into this one sheet. And this is kind of the piece that starts it all. After that are 3 letters. The first is addressing the financial controls that we have in place. The second one addresses our compliance with the federal programs which we received funding from. And then the final one is a report on the status of the financial statements themselves. And they are all addressed to you. There is more to this, and I'm gonna ask Mrs. Hackathorn to email that to all of you, but these are the big broad strokes. There is, believe it or not, a state audit clearinghouse that we will submit this to once it is approved by you all. I told you at the last meeting it was clean. There were no findings from the auditors. So feel free to read, ask questions. But it's a testament to the people who came before me and the people who are sitting to my left that it came back the way it did.
Nice. We need a motion and a second to approve the fiscal year 2024 audit.
So moved. Second.
Any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. Johnson.
Yes.
Vital Statistics Registry appointment. Ms. Hackathorn?
Thank you. As Zibby mentioned earlier, Jackie, who was previously an environmental health clerk, has accepted the full-time registrar position that Kelly Stickney vacated, as you remember last month. It does require a board resolution to appoint her as the registrar, so that's what we're asking for this evening.
Asking for a motion and second to appoint Jackie Mullick, the Clark County Vital Statistics Registrar, effective immediately. So,
Second?
okay, any questions? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
Moving on to staffing changes, Ms. Hackathorn?
Thank you. As you can see, we have some exciting new hires, and then we have an internal promotion that Gracie will share more about in her report. That's all I have.
We have new employees.
Yes.
Okay, we need a motion and a second, appointing new employees to the Public Health Service.
So moved.
Second.
Okay, and Ms. Hackathorn, roll call, please.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. Moving on to Jeff for the financial reports.
Okay, up first are the expenses and vouchers. These are, it's a lot of pages, I know. But these are all of our non-personnel expenditures. They are broken out by fund, and you can see each of those funds. I usually try to highlight a couple of the biggies and then take any questions you may have, and I'm happy to discuss any of them. One of our biggest was we sent a very large check to the state as a part of our vital fees. We do that every quarter. That comes out of our 8201 general fund. And we also had a fair amount of vaccine purchases that came out of that 8201 fund, which is part of the reason we are going to set up that nursing fund next year so we can actually track the ins and outs of those individually. But I'm happy to discuss any of them if you have any questions. It was an expensive month. $475,000.
Sans Pasteur.
Those are vaccines.
Oh,
Now, if I'm sitting on that side of the table, I'm looking at Fund 8220. I want to know why we spent $6,000 on noodle soup.
Good question.
That's really good soup, Scott. I mean,
You wanted to look at that.
I did not tell Emily I was going to say that. So
Which is why I'm offering to take it if you want.
So it's for nutrition education supplies for our participants. We did cups and help me out, Jeff. I can't remember what else we ordered now.
I know we ordered a lot of posters.
Posters,
My
nutrition
Plate posters, I'm not sure it's from
plates.
them, but
Oh, actual My
Yeah,
Plates.
the
yeah.
portion of my plate, Spanish and English.
Okay.
It's a lot of soup.
It's good soup.
So we have before the board, a request for a motion and second approving the expenses and vouchers for October.
So move. Second.
Any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. Johnson.
Yes.
Okay, transfer and advances.
I do have an unbudgeted transfer to ask for. All of our money goes into these purchase orders, and we take a large pot of money and we divide it up into many smaller pots. And this time of year, some of them start to run a little low due to unforeseen expenses or things like that. And it's not that there isn't the money, it's just that we're a little bit over budget in our 8220 WIC account. So what I'm asking for is an unbudgeted transfer of $35,000 out of 8201, our general fund, into 8220, our WIC account. It's not a new thing. It's not going to impact the budget at all because we were scheduled to have a $35,000 transfer, same amount, from 8201 to our refugee health fund, and we never made that transfer. We never needed it. So I'm just asking you to allow us to reallocate the previously approved transfer to go to a different recipient fund.
Okay, we have before the board a request, and I need a motion and second to approve the unbudgeted transfer.
So moved.
Second?
So when we get the money from WIC, it goes back into our, since this is just a transfer, or if they have money coming in, or no?
They have money coming in, yes.
Okay,
If you look at the sheet of many colors, which is the next highlight, they are, geez, I just lost it. They have about $207,000 in the account. It's just, it's not set up in the budget to be spent. And with a lot of these grant funds, we run from one grant year to another during our fiscal year. So we're never exactly sure. And so we're working on the budget right now, best guess, we have a contracted services line in there for a lot of our translators and things like that. It's a lot. We just didn't have enough in the budget for it.
okay.
It's all that soup.
Soup's a different
That's
fund.
more than two. Okay.
I just wanted to ask if what's in front of me says to the to Help Me Grow Fund and.
We were discussing that today. I reviewed both of those this afternoon. Help Me Grow is okay.
Okay.
They have enough budgeted.
Okay,
So it was, I was going to split it between the two, but I don't need
Okay.
to.
I just wanted to make sure.
Sorry, I meant to mention that. I apologize. Thank you very much.
Okay, so that goes to the WIC fund. Okay. And that modification has been made? Ooh. Roll call, Ms. Hackathorn.
Yeah.
Oh, sorry.
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. Moore,
Yes,
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
okay. Monthly fund report.
Sheet of many colors.
Mhm.
Always a crowd favorite.
Yes,
We've talked a lot about the financial situation already. We are in pretty good shape across the board. Mr. Cook pointed out at a meeting yesterday that we have, through the hard work of many of our employees, we've spent, if you take out the money that the government took away from us back in March, and you forget about that for a minute, we have kind of tightened the belts, and we have spent about $500,000, just under that, less this year than we did last year. It looks good.
Okay. Thank you. No action
Yes,
needed.
thank you.
Nice work. Okay. Public health team.
All
Do you
right.
have anything
I
else?
don't even know if I want to call
So I'll
you.
tell you, sometimes, I've taken up most of the meeting, but I do just want, I just want to say, you can see in your packets that we've been very busy in environmental, and we've been down a couple of staff over the last month. But the rest of the environmental health team has really taken on extra tasks to ensure all deliverables are still being met. We were also very blessed with help from a former public health employee who was furloughed from her federal government job for a few weeks. So she came in and helped us. Huge help. So we greatly appreciate her, but I also just cannot express how grateful I am to work with a wonderful group that are so willing to step up and ensure that all the work is being done and done well. So I just want to thank my environmental health staff for really stepping up while we've been down staff.
Very nice. We appreciate them. Nursing and clinics, Ms. Taylor.
If you guys want to take a look at your packet there and look at all the numbers, but there's a few things this month. The first one is we did do the Wittenberg Flu Clinic, and where we got to meet Miss Jessica there. She was there pretty much the whole time. And so their students, they actually administered the vaccines. We have 47 flu vaccines this year there. Miss Renee Centers, who is our communicable disease supervisor, she was our first awardee for the Employee Recognition Award. And so she will be on Facebook, which she's very excited about, and on all the boards around the building. And then since last month, Miss Madison started NCD as well, and so she's been with us for 3 weeks. She's our communicable disease nurse, and she's doing great. And that's about it.
Wonderful. Early childhood, Ms. Lambert.
Thank you. Let's see, on my report, because of the collaboration with Springfield Regional, the case managers at Rocking Horse, Help Me Grow, and WIC, we identified more families that need safe sleep education and the pack and play that would be eligible. So I had asked Department of Children and Health if they would increase our allotment slightly and about 6 months ago, but they just got back to me and said that they would. So we will move from 290 a year to 335, so that's a good thing, I think. It's a slight increase, but it should get us to the end goal. And we kind of started over in a fiscal year, I think, although they're thinking about switching it back to a state fiscal year. But for purposes of this report, this is the first month of the new fiscal year, so we gave away 29 this month, so. That's all I have to see.
Very nice. Any questions for Ms. Lambert? Okay. Women, infant, and children, Ms. Schaefer.
Thank you. Last month, a new fiscal year started, which means an updated assigned caseload for our project. We did see a decrease from last year's goal of 3,552 to this fiscal year of 3,201. I am happy to report after the first month, we are above our assigned caseload. Not sure if you noticed that. And then I also wanted to mention one of our dietitians, Isabel Heising, developed this certificate of recognition to present to our 5-year-olds. So we wanted to give them something just to say thank you for participating and just to let them know that we are still available if they need anything. They also get a nice slinky that Gracie helped give that through the lead grant. So something fun and a certificate for that. So very happy that Isabel was able to create that. And it's been very good feedback from the ones that have already been receiving these.
Looks fun.
Yeah. Also this month, our team began a new venture of Walk-in Wednesdays. And this is where participants do not need an appointment to be seen and can walk in during our set hours on Wednesdays. We've had 3 so far and they have been busy. The number of participants seen over those 3 days ranged from 48 to 60. Yes. And And I want to thank the staff for their willingness to try an alternate approach to our traditional scheduled appointments and working through the unknown. It is an adjustment and we are making changes along the way to make it as smooth as possible. Next, we have also been partnering with Mercy Health on their lactation grant, which they received to implement a community breastfeeding support group. So we are one of 4 sites hosting one of the weekly sessions. Last month was the kickoff month, and while we were prepared, we are sad that no one attended. So we have our next one next week, so we're hoping that the word's been out a little bit more. And that's just our goal, just more promotion and letting everyone be aware that we do have this breastfeeding group. And it's in different locations of the county just to provide different spaces. So hopefully more people can attend. Lastly, we have a new support clerk starting next month, Abigail Stamball, and we're hoping that this will be a good fit. She comes from a preschool background and we're excited to have her on the team.
Okay.
So that's all I have this evening.
Any questions for Ms. Schiffler? Health planning.
Yes, hello, thank you. So, looking at the clock, I will be quick. So the first thing I wanted to mention is we have hired a health planning supervisor. So as you remember, part of the transition plan is to backfill the role that I came from with the health planning supervisor. So we have internal promotion of Jacob Clark. So Jacob is currently the lead on our regional linkage in to care, our drug overdose program. So he's been with the health department a little over 4 years. He is currently pursuing his master's in public health at Wright State. I think he's going to be a great fit. He has a really good working relationship, not only with community partners, but with the health planning team. So I'm excited for him to take this next step and then grow the health planning program even more. As a result of that, for your awareness, we are not going to fill his health, that position. We're not going to add another health planner right now. We're going to take a time to reevaluate some work distribution. I think there's some capacity within the team to absorb all of the work and still do it well to the community. So just a little bit of cost savings there financially. And then the other thing I wanted to mention is in front of you, you have a shiny new brochure. So I think a long time ago, we had what I'm calling a general brochure. So as you know, the health department does a lot of different things for a lot of different people, different sections. And it's hard when someone says, what does the health department do? And you hand them a stack of 50 brochures about different programs. And they're like, I really just kind of wanted the phone number. So I think the need for a simple brochure that lists, it doesn't give a lot of detail, but it gives you access to where to find that information was needed. So we came up with this, and so this is fresh off the presses. These got delivered today. So we're excited about that. So if you see these around, you know what they are. Oh, and Zibby makes a lovely cameo.
Yeah.
She demanded to be in there.
She said, my picture better be in there. No, it's public health in action, so.
Yeah.
I don't blame you, Zibby. You do all the talking.
That's what we were doing there. That was a fun event. We were at a career fair for over at GISA, so.
This is nice.
Very nice.
So
Can I have some of these to go?
absolutely, I'll grab some, and if anyone wants to take some, they're welcome to.
Thank
Thank you.
Thank you.
Okay. Any questions for Gracie? Okay. Health Commissioner, legislative updates.
Well, I'm excited to share a couple of things. First, next month, the next 3-year strategic plan will be coming to all of you. And I've teased that a couple of times, but Grace and I are kind of putting the finishing touches on it. I'm just going to give you a very quick preview. I think I told you last time we have an internal focus part of it and an external focus part. The internal focus section of it will have a handful of focus areas, including workforce investment and retention, culture, and sustainability. And then the external portion will have focus areas of enhancing community connections and expanding access to services. And there's sub-objectives underneath each one of those with very specific timelines to meet those objectives. But just give you a taste of what's coming. It'll be our blueprint that'll run through 2028, and that'll be coming to you next month. Second, another exciting thing to announce. I told Cheyenne I wanted to announce this because I'm super excited, even though it kind of sits in her realm. We have a new partnership with the Pregnancy Resource Clinic. We've worked with them for years, but this is a much more enhanced partnership. They just announced that they are going to create a new location. So if you know where they're at, they're on South Limestone. They have outgrown that location, and they've been looking for a couple of years for another location. And they have found that location. That location is on the north end of town, and it's on Bechtel. It was previously occupied by Planned Parenthood. When they closed that location, they put it up for lease, and they've signed a multi-year lease in what's that plaza called?
The Park Shopping Center.
Park Shopping Center, yeah. It sits between a Chinese restaurant and some of the others have a cell phone company, maybe something like this, I don't know, somewhere in there. But you'll see it if you drive that direction. And we're going to go in with them a little bit. All right. So, the services they provide, we are going to bring the services that we have right now on Sunset Avenue at Southern Village Shopping Center, or sexual health services, to do things that they can't or don't do. And that's mainly STI, treatment and some other things that we do at the Southern Village location. So we'll be going in 1 day a week on Fridays when they open. That's in March. So we'll be partnering with them. And that's being made possible by the Crable Family Foundation. They just recently made a donation, and they wanted us to work in areas of maternal, infant health, women's health, and we are going to honor their request to use those dollars in that manner. So very excited about that partnership. We actually have another planning meeting with them tomorrow. But PRC is a great entity to work with, and I'm glad that we'll be able to enhance the services that they offer in a new location. So very excited about that. In March, just a quick minute about property taxes. I don't know what to tell you. There's so many things going on, and I don't know what's up or down anymore, frankly. There are so many bills at the State House, to anywhere from completely, eliminating property taxes to saying, well, having a czar that says you may or may not have a levy in your county. It's all across the board. I don't have a crystal ball, wish I did. But I don't know what's going to shake out to be. I know that if the legislature doesn't do something, there's probably going to be a referendum next fall to eliminate them. And I will tell you, without a plan of how to make places like, health departments and libraries and streets and roads and parks and fire and EMS there's got to be a plan. It's fine if we want to make a change in Ohio, but we've got to come up with some other way to fund these necessary entities. I don't know how it's going to shake out, but as you've heard me say, our levy is on next year, so it'll be interesting to see. We have every intent of putting a renewal levy on next year. It would be, I would hate to say this, but watch our levy pass and then they eliminate property taxes. But we got to do it. We have to operate on the assumption that they're going to be there in some form or another. So, by the way, that levy process starts very early. It will be starting in the spring next year. We have to have certain things done for the Board of Elections, and the county commissioners have to approve our levy request. So, first of next year, you'll start hearing me talk about November already for next year. House Bill, let me mention very quickly 2 House bills. House Bill 561. Let me flip to my paper here. House Bill 561 has to do with vaccines and exemptions in schools. We already have codified things in revised code, administrative code, about exemptions for vaccines. This makes a few changes. Some things here are very concerning to me. One of the things, it removes hepatitis B vaccine requirement for preschoolers to, quote, align with federal recommendations. That hasn't been removed. The CDC and ACIP both say you still have to have, there's been some talk about that, but they're making moves now to do something that actually doesn't exist at the federal level, which is concerning to me. Does other things like prohibits the exclusion of healthy exempted students during disease outbreaks. That's very concerning to me as well. But across the board, it's not evidence-based from any perspective. Conflicts with the CDC and ACIP. for maintaining high immunization rates to prevent disease spread. They haven't cited any scientific or evidence-based studies that encourage this to produce better health outcomes. So very concerning. We're watching how this is moving. Frankly, there was a bill just like this back in 2021, and it never got out of committee. There's a belief by AOHC lobbyists that this will not make it out of committee either, but just wanted you to be aware of that one. House Bill 561. House Bill 520 is what's called the Blue Ribbon Bill. It's very interesting. It would create what's called a Blue Ribbon Committee in every county to evaluate taxing units and look for duplication of services and recommend consolidated and shared services. I have no problem with efficiency. We do that every day here. Unfortunately, this committee that would be created in every county could and would impact the health department, but there is no representative from public health on this committee. It is represented by the county commissioners, county auditor, the mayors of municipalities, township trustees, superintendents of school districts, and no health department. So it'll be interesting to see if this makes it out of committee. Again, I'm not opposed to efficiency and it's perfectly fine, but I don't like not having a voice at the table when it does impact us. So we'll be watching this Blue Ribbon Committee bill. I feel weird saying that. I don't know, that's kind of strange. Let's see. The other thing that I just want to mention too, I'm going to get on a very brief soapbox, so bear with me. I don't know if you noticed, but the CDC made a change to their website yesterday at the direction of HHS that included new anti-vaccine rhetoric and falsities about the link between vaccines and autism. Thankfully, there are still some pages on the CDC website for parents that shows there's no relationship between vaccine and autism. Which is the evidence-based truth. The vaccine-autism relationship is probably one of the most studied relationships in human history. And there's simply no evidence that shows a link between the two. Just like the false link between Tylenol and autism, a rhetoric like this spreads false blame. And frankly, I think it creates false hope for parents for things that are not evidence-based. Today, the Autism Science Foundation came out with a statement and said they were appalled by this change that was made to the CDC's website. I will tell you, never in my lifetime did I think that CDC would be spreading dangerous misinformation, very likely under orders and under duress from HHS, but it's definitely going to adversely affect the health in kids and definitely confuse parents. I'm worried about the future of public health here in Clark County and across the nation. I'm also worried that immunization rates and diseases that frankly should be in the rearview mirror are going to come back and haunt us. We saw this week that Canada lost their measles elimination status. And I got to tell you, I don't think we're far behind. We can't do public health like this. We can't do public health by vibes. We can't do public health by influencers and cherry pick data in this nation. It's an insult to me. It's an insult to everybody that's dedicated their careers to science. Frankly, I believe the HHS secretary does not represent public health, the scientific community, or the scientific process. Our commitment here locally will continue to be that we are going to use evidence-based, make evidence-based recommendations to the betterment of the health of our community. We're going to keep our motivation pure and unbiased, and we're always going to follow the scientific method here in Clark County. I hope research continues in the area of autism to give parents more information about the health of their children, but I'm going to say unequivocally, vaccines do not cause autism. So pot's done. Thank you.
Okay. You don't need to set a date for a special meeting?
We don't. I'll explain why. I thought we were going to have a special meeting for the 2026 budget. Timing wise, we have to get things to the county auditor so they can do what's called a budget commission and then adopt our budget. But thank you to Dave Crew at the auditor's office. He said after our regularly scheduled December meeting on the 18th, if we can get them everything, when you approve it there, get them everything by the 19th, they'll be good for Monday the 22nd. So I was thinking we were going to have something before then, but I think we're good as long as y'all show up and we have a quorum on the 18th. Because if that doesn't happen, you just totally derailed my plan.
All right. additional business, I forgot to ask. Do we have any additional business? Okay.
Just on that, on the 18th, will there be snacks?
Mike, if that gets you here, I would absolutely get some snacks.
All right, our next meeting is set for December 18th. Please mark your calendars, so that we'll be here and we can get the budget approved. And I don't think that we have anything else going on, so this meeting is adjourned. Can I get a motion, please?
So moved.
Second.
All right. Anybody want to talk about why we shouldn't? All right, can we have a voice vote? A vote.
All those in favor?
Aye. Yeah, aye in favor. Okay, any opposed? All right, we're good.